And I'd like to talk a little bit more about validation. Validation, from my perspective, is a key component in the assessment of any new health technology, any new medical device. And validation allows us to be confident that the device is accurate, is safe, is reliable, and importantly, can be trusted. Now, occasionally in health tech, we see this move fast and break things approach, and there seems to be a greater focus on getting to the prancing unicorn and skipping over the validation steps. And that can cause problems. And I think the best example we've seen in modern history is the Theranos story, which I'm sure many of you would have come across. This was a Silicon Valley health tech corporation who claimed to have developed a blood testing technology which could do multiple tests on a finger prick of blood. Sounded fantastic. At their peak, they were valued at $9 billion. Sadly, the technology didn't actually work as claimed. Theranos was subsequently liquidated, and Elizabeth Holmes is currently undergoing fraud charges in the US. So my story with Babylon, no association there, starts back in January 2017 with this tweet where it was claimed that artificial intelligent chatbot was going to be trialed in the NHS. And I thought, that sounds interesting. I'd heard about Babylon. I'll have a look. So I downloaded the app. And this was my first experience. I have diarrhea. First things first, have you recently injured your stomach in some way, including a burn or a bite? Now, to me, that doesn't sound like a sensible, intelligent question to ask someone who's got diarrhea. And I asked Babylon a simple question: has the app been validated? Here we are 3 years later, asking the same question. Has the app been validated? Over the subsequent weeks, I wasn't particularly interested this time. A lot of these tweets were deleted because I didn't think they were particularly interesting. Over the next few weeks, I tried it again, and this time just using a classic red flag presentation. So someone who, if they called NHS 111, they'll be said, get to A&E, get an ambulance. So here we have a 48-year-old heavy smoker who's woken with sleep with chest pain, and the app's saying, go and get a GP appointment. And at this time, there was increasing interest on Twitter, primarily with regards to the absence of any public information about a trial, validation methods, safety, adverse effects from this medical device. Some people were even concerned that there may be a risk of patient harm. Babylon did make some contact. They posted this tweet and pointed towards a document which was held on an online server. My question was was asking for a validation study. The document which they posted is shown here. It's still available online. It does mention validation in it and how they tested the system, and they talk about semi-naturalistic deployment study, but this is not a validation study. In their conclusion with this study, they described validation performance in a deployment study. It was not a deployment study. What they had done is tested the chatbot across 102 mock consultations. This is where actors are pretending to be patients. They trial it against the chatbot. And you can see their results here. Validation performance is more accurate than doctors and nurses and 100% safe. So if that was just an internal document saying, look at this, aren't we great? Fair enough. But it didn't end there, unfortunately. And the tech media advertised this as an academic study where Babylon's symptom checker outperformed a doctor and a nurse when it comes to triage, the company said. Got in the Daily Mirror, Ali Parsa, founder of Babylon, claims his new device is safer than visiting a doctor or nurse when you're worried about any diagnosed symptoms, and goes on to state, Ali also claims the app is 100% safe for checking symptoms. They also used it in their NHS promotional material. So this is a 2016 document, again, still available on the website, where if we read here, Babylon's AI symptom checker has been tested against clinicians. It's safe, more accurate, and faster. And the same 100% safe claim can be seen. So going back to my story, I say as a consequence of Twitter interactions, it was suggested that these concerns should be raised with the CQC. I had raised previous concerns with the CQC, but not related to Babylon. And I sent them this note. My concerns relate to the Babylon Health app, the apparent absence of any robust clinical testing or validation. A month passed, and they got back in contact with me we had some telephone conversations with the CQC. They seemed quite interested and concerned about what I'd raised, and sounded like they'll take it forward. And I signed off an email in April 2017 stating that 111 triage is not related to my area of care. So moving forward, I'll leave this with you and the MHRA and focus my efforts elsewhere. Moving on, months passed, nothing came back from the CQC. In August 2017, I tried the NHS 111 Babylon app and found that patients with referred cardiac chest pain, so where chap who's having a heart attack, pain in his shoulder, going down his arm, again, it says get an ice pack for your shoulder. It doesn't pick up the risk of a cardiac event in this patient group. So I went back to not only the CQC at this time, but also the NHS patient safety team. This is an extract from my email. I find it incomprehensible that a critical service such as NHS 111 can be handed over to a poorly developed, seemingly non-validated system with no apparent oversight regarding patient safety. Things, they responded to that. They came back to me and said, we're looking into it, we'll get back to you. Things quietened down again. In May 2018, I noted that Babylon had upgraded the chatbot. When I say upgraded, I mean made it even more dangerous. So this is a case of an overweight 20-a-day smoker who's having a barn door heart attack. You know, my 8-year-old would say you need an ambulance if someone presented with these symptoms. The chatbot says panic attack. Around that same time, a case with a typical PE, DVT, swollen painful leg, breathless, chest pain, the chatbot suggesting Charcot's joint. Anyone medical in the audience would just realize quite how ridiculous that is. So this time it got more interesting. So it was quite clear that the MHRA were watching my Twitter feed, not quite as closely as Babylon, I suspect, but they were watching. And I got an email from the MHRA indicating that those two concerns, the risk of a missed heart attack, risk of a missed PE, were being flagged as incidents. And they also asked, we need your permission to give your personal contact details to the manufacturer. I politely declined. And I did at that point, this is back in May 2018, I'll be happy to present the issues at an open roundtable meeting or a conference in the presence of the regulatory bodies, and I'll just require a written statement from Babylon that they will not pursue legal action, and publishing the results is within the public interest. Now, at this point, I think just as you can see my level of anxiety at this time by the subsequent email, which was just, oh no, this is how I closed it actually, I like this. Just as the closing of that email, I'd be grateful if you could ensure definitive action is taken to protect the public from this widely publicized, untested, unvalidated, unsafe medical device. So a couple of days later, I sent a further email to the MHRA because I was concerned about what I was seeing, indicating that I suggest we have a face-to-face meeting to discuss the concerns. I'm particularly concerned that the chest pain triage algorithm is just as dangerous today as when I first flagged it in February 2017. I'm in London, Tuesdays and Thursdays work for me, thanks. They didn't respond. There was no contact from Babylon either at that time. As a consequence of that, I'd had some contact from a journalist at the HSJ, and I sent the correspondence I had from the MHRA to the HSJ, to the journal, and say, would you do an article on this? I'm concerned. And the HSA were fantastic, and they did a hype-free headline here, safety regulators reviewing concerns about Babylon's chatbot. This is the response to Babylon, from Babylon. A number of vested interests would like to see us fail, often resort to anonymous attacks, false allegations. Maybe we'll talk about those in the panel meeting. And some claim to be doctors, deliberately misrepresenting information which raises serious probity and professional standards issues. There was a further comment, which is either more concerning on the online response to the HSJ article, where they say anonymous complainant claiming to doctor has taken their complaints to the MHRA. The MHRA has asked us to look into these, and having completed our own assessment, we have confirmed to the MHRA that there are no safety concerns. There was a editorial subsequently in the HSJ where there's a suggestion that Babylon may have approached the HSJ with legal threats as a consequence of that initial publication. And then again, that's a concerning feature, and maybe we'll hear the truth of that over the rest of the afternoon. At that point, I was clearly getting nowhere with the regulatory authorities. Babylon weren't engaging, and the bad bot threads commenced. So the bad bot threads, I don't know if you haven't looked at them, have a look at them. They're entirely evidence-based. And the first thread was published around that time. And again, this was people on Twitter saying, God, Dr. Murphy, you've got some interesting stuff there, but it's really hard to follow. Put it in a thread or a blog. So the first thread was 44 tweets long, and this was the final comment, and I closed it with, please drop the hype, which is my biggest concern here. If you're developing a technology, don't claim it's 100% safe. Do the studies, show us the data. Babylon weren't listening, and at the same time, they did a big PR event at the RCP in London. The chair of NHS England was present, Malcolm Grant, and they planned to reveal the future of artificial intelligence in healthcare. Sounds good, doesn't it? So they did, and at that point, they claimed that their AI had passed the relevant parts of the RCBGB exams, making it invaluable, providing health advice, and bring it up to the safety and accuracy of a real-life doctor. This is one of their further claims, which was promoted at that time. So anyone, no matter where they are in the world, can get free access to health advice that is on par with top-rated practicing clinicians. So that obviously made some headlines. This AI can provide health advice that is as good as real doctors, and they talk about rigorous testing in collaboration with the Royal College of Physicians, Stanford, Yale. You can trust this. This looks trustworthy, and describes how you can now get health advice and points towards research which has been published. As far as I'm aware, the research has never been truly published in the academic sense. It's on an online server, but it's never been peer-reviewed as far as I know. Correct me if I'm wrong. There are a number of notable people on Twitter who were a bit wary about what was being claimed and raised some methodological concerns with regards to the way the evaluation had been undertaken. I did my own test and simply tried the chatbot. And again, a patient with a classic symptoms for a heart attack was being advised that you're having a panic attack or a phobic disorder. And similarly, a patient with a barn door PE was coming up with gastrochondritis and a broken ankle. At that same time, concerns were raised with regards to the AI that Babylon had rolled out in Rwanda. And this is the health minister for Rwanda talking on a BBC Click program at that point, where she highlighted that the algorithms didn't include common conditions for Rwanda, such as malaria, HIV, TB. In November, Babylon featured in a BBC Horizon program and asked the question, could a machine replace your doctor? I think the answer was a resounding no, if anyone's watched the program. And later on that month, there was an article published in The Lancet whereby people reviewed the evidence base that Babylon put forward for the chatbot and concluded that further clinical evaluation is necessary to ensure confidence in patient safety. So Babylon haven't been particularly successful in providing evidence of validation, but they have been successful in other areas. For example, one of their initial investors was the founder of Google DeepMind. They've got collaborations with Bupa, obviously the Rwanda project in conjunction with the Bill Gates Foundation. Deals with Samsung, TLS, that's a GP at hand service, Prudential, Tencent. Last, I think it was a year or so ago, there was a deal with the armed forces in the UK where they were going to pilot the chatbot to provide advice to our armed forces. And last year we heard about the investment from the Saudi Wealth Fund, which gave Babylon their unicorn status. Oh, forgot Matt Hancock as well, yep. He's their #1 fan. Most recently, just in January, we heard about the latest partnership, which is a 10-year deal with Wolverhampton NHS Trust. And I was concerned to read the way this had been reported in the Times. So David Loughton, who's the chief executive of the trust, says that the app's AI triage system was as good as doctors at making initial diagnoses. I'm not sure there's any evidence to support that. And personally, I'd actually disagree. And I'll show you some evidence with some new tweets. I'll tweet this in a moment. So a 67-year-old Caucasian male, 20-a-day smoker, so high risk for cardiac problems. He woke up with central dull aching chest pain at rest. Is it a heart attack? Chatbot says no, it's gastritis or sickle cell crisis. Furthermore, 37-year-old Caucasian female, ex-smoker. She's recently returned from a holiday on a long-haul flight. She reports a 2-day history of pleuritic chest pain and a painful right calf. Could this be a DVT and a PE? Might be, not according to the chatbot though. It's flu and a calf strain. And both these cases are ones which should be flagged for urgent assessment, but the chatbot saying go to or see your GP. And from my perspective, I think some of the same fundamental flaws that I first raised 3 years ago are still present in the chatbot today. And moving forward, my plea is to have less focus on the prancing unicorns and more focus on the data to show us that we can ensure these technologies are accurate, safe, reliable, and can be trusted. Many thanks.